The Rutherford Institute has been in the middle of this controversy over the full body scanners and the pat downs we're seeing in United States airports. We filed a federal lawsuit with two pilots, Michael Roberts and Ann Poe, and shortly thereafter the Department of Homeland Security, whom we sued, and the TSA, which runs the airports, and the government agency that runs the airports, they've decided they will lessen the rule on pilots and come up with some kind of a card identification program. But for the average passenger, the body scans, the full body scans, and the pat downs are going to continue. There will be other lawsuits filed across the country, hopefully to stall those. But those will be much more difficult lawsuits, and they will probably progress through the courts. In the meantime, millions of American passengers going through airports are going to get the full body scans. We've researched the issue here, and it's very clear that a number of medical authorities are coming forward now and saying the full body scanners may be dangerous. 4 scientists out of the University of California now have said that they are dangerous. The main problem is that they focus radiation on the skin and could cause skin cancer, gene mutations, and some medical authorities are strongly cautioning pregnant women not to go through the full body scanners because it could hurt their unborn children. And children definitely should not be going through these machines. Columbia University Center of Radiology now has come out and warned that the radiation may be 20 times that on your skin, the radiation you receive from a full body scanner, than you would get at a doctor's office. All of this evidence has been presented to the United States government, and they have not listened. Janet Napolitano, Department of Homeland Security, and John Pistol, who is head of the TSA, both of them are saying, well, these scanners are really safe, folks. Don't worry about the radiation hitting your skin. And they've even said, well, the Food and Drug Administration now has held that these things are safe. But all you have to do is just a little research in the Food and Drug Administration of the United States government and see that they do not do an adequate job of protecting the American people. It's an organization that has been charged with corruption, mishandling of drugs, and putting drugs on the market. They're faced with a number of lawsuits with drugs they've put on the market that have harmed and sometimes killed American citizens. So this is not a reliable agency to get the information from. There are credible authorities, as I said out there now, are saying these things are not safe. So what is the problem here, and why is the government rushing forward to do this, and who's the real culprits in all this? First of all, we have to recognize the individuals foisting these on the American public, from President Obama allocating money for them, to Janet Napolitano, Pistol, who runs the TSA. These people don't go through the body scanners. They fly on government airplanes and private jets. The congressmen who are sitting on the sidelines and doing nothing about this, they don't go through the body scanners, so they're not exposed to this radiation. We also have to remember that we're unwitting victims of the corporate state. As I pointed out in a number of my commentaries, which can be found at rutherford.org on this issue, basically these machines were sold to us by corporate lobbyists, and our government bought them, the Department of Homeland Security, without adequate testing. So they have not been adequately tested before they're forcing us to go through these particular machines. So do I think that the government's really looking out for the American citizens? No, I don't. I think we're very expendable in their eyes. So what should be done here? Well, the 4 PhDs from the University of California are calling for a moratorium on these machines. They should be pulled out of the airports and studied by an independent commission. That's what needs to be done here. If they can be altered so that they can be safe, and that they won't be virtual strip searches, show us nude, then maybe they might be acceptable in American airports. But I'm not sure this can be done. So what our Congress needs to do, and we need to call on these people that we've elected to be our so-called representatives, these machines need to be pulled out of the airports at this particular time, and they need an independent commission needs to be set up expediently and quickly to study these machines to see if they're safe. So the real culprit here is our government. They need to ensure that our freedoms are protected, that we are safe and secure in airports, and that our health is not put at risk.